So then what is unblinding? You can see that if you are revealing the treatment group of a subject, for example, there is a subject, okay, say the subject ID is 001, and if you are able to figure out to which treatment group the subject belongs, so there is a patient and if you know the treatment group of the subject, then it is called, if you don't know, so if you are able to maintain that the investigator or the team doesn't know about the treatment group of a particular subject, then it is known as blinding. And also in the same way, there is a kit 005, and if the so by using the system, if you are able to maintain the blind, that if the users in the system, users of the system, either any of the team members doesn't know the kit type associated with a particular kit, then it is known as blinding. So blinding can be for both the treatment ID and kit ID. If you are just saying the treatment ID, that is a blinded information. If you are just saying the kit ID, that is a blinded information. Then what is unblinding? So if you are able to, if the system reveals that 0001 patient belongs to a particular treatment group, or a kit type 005 belongs to a particular kit type, okay, a particular kit 005 is a kit. If the system reveals that this kit belongs to a particular kit type, then it is known as unblinding. Either the unblinding can be for a subject, or it can be for a kit. So if you know to which treatment arm this subject belongs, then it is unblinding. And if you know to which kit type this particular kit belongs, then it is known as unblinding. Then partially unblinding, yesterday we have discussed this in deep. So this at least you should have two kits or two subjects for this. So subject 1 and subject 2, if you are able to figure out these two subjects are equal, same treatment group, that is known as partial blinding or partial unblinding. Or if you are able to figure out this subject 1 and subject 2 doesn't belong to same treatment group, then also it is known as partial blinding or partial unblinding. In the same way, for the kit type, for a kit, you have kit 1, okay, and if you are able to figure out that kit 1 and kit 2 belongs to the same kit type, okay, then this is as partial blinding or partial unblinding. And also if you can figure out kit type 1, kit 1 and kit 2 doesn't belong to the same kit type, then this is also known as partial blinding or partial unblinding. So there are a lot of scenarios in which partial unblinding can occur. There are very few concepts related to this in IRT. IRT we don't use much for partial unblinding, very less information. But when you come to actual delivering of the study to the sponsor, you have to be very cautious about this partial unblinding. There are a lot of scenarios in a live system. The mistakes you do in a live system can partially unblind a subject. Based on the blinding, clinical trials can be divided into various things. The main one is open label or blinded. Open label, all the parties, investigator team or sponsor team or the subject, everyone knows to which treatment arm the subject belongs. In blinded study, okay, all these people doesn't know, any of these people, either investigator team or a sponsor team or a CRO team or the subject will not know to which treatment arm they belong. Then that kind of a trial is known as blinded. And there are a lot of definitions for single blinded, double blinded. If one of the parties is blinded and one of the and the rest of the people are unblinded, then we call it as single blinded. So double blind, triple blind, say for example you can take here. So investigator knows and the clinical team knows, but the subject doesn't know about the treatment group to which he belongs, then we call it as only two groups of people are blinded here. That's the reason we call it as double blind. Okay, or there are a lot of variations in it, but no need to worry about this. Main concentration would be on open label and blinded, but these our system can be maintained as single blinded, double blinded, triple blinded, whatever they call, maybe 4 blinded, 5 blinded, 10 blinded. So whatever they want to do, we can manage the system to be like that based on our configuration. So it is well controlled in our system, so that whatever they want, they just want open label, they want blinded, they want single blinded, double blinded, triple, 4, 5, 6, whatever the type of blinding they want, that can be configured in the system. This is one of the important definitions. So you have to understand what is what is blinded or blinding. So what is blinded or blinding information or data, what is unblinded or unblinding information or data. Okay, so any data or information that can be anywhere in the system. In next slide we will check where that data can be, in what are all the places that data can be. So we will look into blinded information. First we will take a subject 1. Okay, subject 1 will have if I say subject 1 or subject ID, it is same. Okay, subject will have a subject ID. If subject ID is mapped to treatment ID, this information is blinded information. In the same scenario, a particular kit 1 is mapped to kit ID, or subject 1 or subject ID is mapped to kit ID. Even these two scenarios are considered as blinded information. If you understood what is blinding, what is unblinding, if that is in your mind, it is easy to understand. If you don't understand what is blinding and what is unblinding, you cannot understand what is blinding information or blinding data. In the same way, we will come to the subject 1. If the investigator knows treatment group, or for a particular kit, if the investigator knows kit type, or for a particular subjects, if the investigator knows kit type associated with all these scenarios, comes under unblinding. Then next important thing, what are all can be blinded and unblinded. A role in the system, we are having the role, right? A particular role in the system can be blinded, unblinded, or partially unblinded. A user can be blinded, unblinded, or partially unblinded. A widget means whatever the widgets we are using in the dashboard. Each card or widget, there are different names. Even any widget can be blinded, unblinded, or partially unblinded. A particular report can be the same. A notification can be the same. A alert can be the same. A transaction can be the same. Okay, so these are all the various components of IRT system where it can be blinded, unblinded, or partially unblinded. Just as of now, you remove this mapped word. Okay, so when we go to reports, we will look deep into the mapping, how each everything is mapped in the system. We will look there. As of now, you just see. So or else it will be very easy to understand. In any of the role or the user or the widget or the report or the notification, alert or transaction, if these two are mapped, kit ID and kit type, are present in a particular report, then that report is unblinded report.
Cleangenius Research.